So at this point, my DVT protocol for the last 2 or 3 years now is using the ActiveCare. I find it to be equally effective as any other treatment that I've ever utilized, any other prophylactic mechanism that I've ever utilized, and I find it very favorable in terms of patient tolerability, efficacy, and of course safety. Our transfusion risk now over the last 250 straightforward primaries is 0. So our bleeding has gone way down, and we've actually published this data, at least a preliminary pilot of that cohort of patients.
But most substantial is actually our reduction in our readmission rates, our reduction in hematoma formation, or the need for reoperation. And part of that is with this combination of the pumps and aspirin, we've really substantially reduced those wound complications, which can be sometimes the most critical part of the patient's care if they develop those problems or get a deep infection because of continued drainage. So I would say the patient satisfaction is very high compared to some of the chemical prophylactic agents having to have routine blood draws or not being able to eat certain fruits and vegetables and changing their activities. That's an inconvenience to their lifestyle. Many patients like the pumps because it gives them a gentle massage of their calf. And from us, it's been an effective way because we can also measure their compliance. So we make sure that actually they are using the pumps in an appropriate way because we don't want them to have a complication. And if they were, we want to make sure that they were taking ownership of their own health as well. As we've moved into the bundled environment, we're very sensitive to these metrics and we watch them very closely. And our patients with the pumps have performed very well within our bundle and saved us quite a bit of money.
We have a very difficult time getting patients in their therapeutic range with the use of Coumadin. And so despite our best efforts, despite looking at their medications, their history of any liver disease, and those factors, looking at our recent data, which we published in Journal of Arthroplasty, only approximately 50% of the time are patients actually within that therapeutic range. So one of the nice things about the ActiveCare devices is that you can measure compliance, but you can also avoid a lot of those draws, and you know that they're actually doing their job and that they're working, they're actually in effect.